Let's take a look at the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM. The current edition of the DSM is the DSM 5 TR, which stands for Text Revision. So, just what is the DSM? The DSM is the official classification system for all 300 plus mental disorders. It is used by health professionals in the US and also in some of the other countries. It provides a standard of diagnosis. It also provides symptoms and diagnostic criteria for each mental disorder. It's often referred to as the Bible of psychiatry. So every mental health professional that engages in diagnosis will have a DSM. And within the DSM is disorders and the criteria that must be met for a person to be diagnosed with that disorder. The disorders also have a diagnostic code that's used for communicating this disorder and also for insurance purposes. The DSM dates all the way back to 1952 when the first version or edition of the DSM was published. Since then, it's gone through several revisions, and different disorders have been added or removed or revised, and to get to the place where we are now, which is the DSM 5 Text Revision, TR, which was published in 2022. So there's been different disorders that have been added, and also disorders such as Asperger's that was removed. Asperger's is no longer a disorder. How is the DSM organized? The DSM is organized into diagnostic categories, starting with those that typically are diagnosed in childhood. These include the neurodevelopmental disorders, such as autism, ADHD, intellectual disability disorder, etc. So and then we move on and we have all these different diagnostic categories. And then in each diagnostic category are the actual disorders themselves. For example, let's take a look at the diagnostic category of anxiety disorders. So we have over 10 different disorders in that category. These include anything from separation anxiety disorder to agoraphobia to generalized anxiety disorder. And let's zoom in on one of those disorders, generalized anxiety disorder. So as we can see from this image, generalized anxiety disorder has certain criteria that must be met in order for it to be considered a disorder. So for instance, when a person goes to see a mental health clinician, he or she must align with certain criteria in order to receive a diagnosis. That criteria includes, for example, criterion A, which is excessive anxiety and worry occurring more days than not for at least 6 months, and there are about a number of events or activities. So the worry and anxiety is excessive and occurs for a duration of at least 6 months, and then we have criterion B. The individual finds it difficult to control the worry. So remember, both criterion A and criterion B must be met, as well as criterion C. Criterion C says that the anxiety and worry are associated with at least 3 of the following 6 symptoms, with at least some symptoms present for more days than not for the past 6 months. So it can't just be happening for one day here and there, but at least most days for 6 months. And these 6 criteria, now remember 3 of them must be met, include blanking out or difficulty concentrating, easily fatigued, changes in sleep, being keyed up, on edge, or restless, irritability, muscle tension. So those are the 6, and 3 of those must be met, along with what we mentioned before, criterion A and criterion B. Criterion D is the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, and other important areas of functioning. And then criterion E, the disturbance is not attributable to the physiological effects of a substance, such as a pharmaceutical medication or some sort of illegal drug, or even a medical condition. Because as we know, certain medical conditions, such as hyperthyroidism, might create symptoms that look like anxiety disorders. And criterion F, the disturbance is not better explained by another mental disorder. So this is important because symptoms of mental disorders, there's a lot of overlap. So we really have to hone in and find what disorder best fits the symptoms, and then determine if those symptoms meet the diagnostic criteria. Who even creates these disorders and the diagnostic criteria for these disorders? Well, that would be the role of the American Psychiatric Association. So there are several people on board with the American Psychiatric Association, and so they determine what gets added and removed from the DSM. Sometimes this determination is made from ongoing research. Other times there could be socio-political pressure to remove or add a disorder. So again, this just highlights that subjectivity of mental disorders. Because remember, there are no lab tests that will diagnose. Also, there is no imaging test, such as an MRI or SPECT, PET scan, that kind of thing, that can diagnose. Now, they might assist in the diagnostic process and provide us with insight into the areas of the brain that are experiencing some sort of dysfunction. But alone, they don't diagnose. So we really are dependent upon the subjective diagnosis of mental health clinicians, as well as the subjectivity of the disorders themselves that are added and created and put into the Diagnostic and Statistical Manual of Mental Disorders.